This is the hyperbaric chamber in Sharm el-Sheikh. Mi fare queste cose.
No. Where are we today, Tito?
On Earth. On our planet.
Today we are with Dr. Ahmed Sakr from the Hyperbaric Medical Center in Sharm el-Sheikh, which gets very busy all year long with a lot of cases. And we're going to learn more about how hyperbaric chamber works, how their operation here in Sharm el-Sheikh works. So come with me and Tito Zappalà, learning more about hyperbaric medicine and why it is important also for free divers to learn, not only for scuba or technical diver or saturation diver. It's very important for free divers as well.
Dr. Ahmed can introduce us the hyperbaric chamber, how it's working.
Okay,
Recompression, body, gas, decompression sickness,
cool.
provide the oxygen.
Why it's important to know this thing?
Safety first, it's knowledge. How it's working, how to avoid everything. Blah blah
As
blah.
a free diver.
Blah blah blah.
My angel. Good morning.
Good to see you. All تمام? Nice to meet you. Hello guys.
Dr. Ahmed.
I'm Ahmed. Nice to meet you. Ahmed. Hello. Nice to meet you.
I'm Elena.
Hello Elena. I'm Ahmed.
My angel.
Thanks. Very good. We are here at the Hyperbaric Medical Center. This center is specialized in treating diving-related problems. So health issues, health conditions that has something to do with the performance in diving or that happened after diving, this is usually the place to see. In the world, there are many hyperbaric medical centers. Depending on the place, you will get the type of diving activity. So, for example, it can be commercial diving, it can be touristic diving, it can be recreational diving, it can be technical, it can be a mix of everything. Here in Sharm el-Sheikh, the main activity of diving is touristic diving. So we get the recreational and the technical. The location where we are standing is chosen because it's easy access to the three main ports and the big international harbor. So if there is any boat coming with a case, there is easy access to the chamber that we don't waste a lot of time to give the service to the patient. The place is equipped with a helipad. If you look behind you, there's a concrete circle. That's for helicopter. For the moment, it's not working because by mistake, they put the post lamps that you see, which can be dangerous for the helicopters. But there are also other services like search and rescue activity and stuff like this, and ambulances to bring the cases in a good timing if needed. The chamber here itself is equipped with a small boat, with an ambulance car, and two recompression facilities. One of them was the older one, which was brought here in 1993, and since then treated around 1,400 cases. Over the years, there was curves of high tourism with a higher percentage of divers and years of lower tourism. Tourism is a little bit fragile to political situation. So if there is any political problem around in the area or inside the country, tourism is affected and therefore the diving activity itself. I will show you now inside the first place, which was brought from the States as a donation to America, from America to Egypt. It is 3 containers that were brought. Can we take pictures? Yeah, sure. Come in, guys. As we walk in, you will find the 3 containers continuing. And here is the first recompression chamber. This model is an American model, made 1992, put in the place in 1993, and since then operating. The design from the fact that it's sent to a remote area like Egypt in the desert where you can't get high sophisticated or high assistance or maintenance. So everything was basic, made in very sturdy way that can tolerate the pressure changes, the weather changes, and very tolerant and easily maintained. So with the presence of big amount of spare parts, we are good to go for many years. Luckily, alhamdulillah, touch wood, since it was brought, it's working every day serving divers. Right. And I will show you the later details and the design that allow us to make changes and make maintenance without having any big problems. If you come,
This is the one I told you guys. This is the small one.
if you come with me here, I will show you more and then we start the real talk.
Assistant is sitting inside with the victim, or
Most of the time, yes, there is an assistant sitting with the patient. There are some rare cases where the patient can go alone if he's an experienced patient or not his first time, and this is very common.
An experienced patient. Interesting concept.
There are experienced patients, I tell you. Okay,
customers.
so guys, let's start the real talk. I understand you're coming here to have an orientation tour about the chamber. So I would like to tell you the basics of any recompression facility in the world, and then you apply it on our chamber or other chambers if you visit one. To have any recompression facility in the world serving divers, mainly scuba divers and to a less extent skin divers, this we can discuss in a later phase, you need 3 units. Air production, which are the big 2 compressors that you see there. 21%. They bring air from outside source through a snorkel, going through a filtering system. These are high output, high pressure compressors that you see. To put it in the second unit of a recompression facility, which is the air bank or the air storage. These are submarine flasks that take up great pressure inside. And usually with one of them full, I'm good to run for maybe a couple of weeks. So I keep them half full so to avoid straining my metal and elongate their duration, keep them in a good shape.
Couple of weeks of chamber operation or couple of weeks of average patient
Every
intake?
day recompression sessions, every day recompression sessions.
Okay.
Yes.
So in a high peak season, you have patient every day.
It can be, yes. Or one patient requires to go in every day
Right.
until he's feeling better. And this can take maybe 5 days, can take 15 days, depending on the case.
Thank you.
So, Gabriel, can ask? So, this focus membrane, yeah, nitrox kind of nitrox.
No,
membrane.
there is no nitrox here. This is
Oxygen membrane.
No, not even oxygen membrane.
Yeah.
This is a normal air compressor. Yes,
This
the
to
two,
behind.
the two
Okay.
that you see the white
All
ones
right, and then you have air,
inside. Air,
just air.
air. You-
Okay,
Oxygen I will get from Cairo from a medical gas company, which is only serving medical gases. So a high degree of purity. I bring it from Cairo and I put it in my green tanks. In my green tanks, I have 100%. In my black tanks, I have air. I get to mix them, high pressure air and oxygen coming in the pipeline to meet here on an oxygen analyzer, where I can make the nitrox mix that I need according to the percentage I need, according to the protocol I choose. I'm not here making diets. I'm making here treatment sessions using a treating gas. So it can be that I change the percentage of oxygen or use helium in a different way than diving. I want to go back to the main thing that I said. There were 3 items for any recompression facility. Air production, which are the compressors, air storage, which is the black submarine tanks, the bank, and the recompression unit, the chamber itself. The recompression unit that you see here is something called high pressure manual run chamber. This specific type is called on-deck recompression facility because the same complex that you see can be put on a boat or an oil rig. Why is it manual? Because all the valves that you see
It's hydraulics.
are manual run.
It's not electronics.
Yeah, exactly. Minimal electronics.
Minimal electronic. I can see
That's
that.
problem. If there is a problem, I don't have a problem. However, I have a generator, 2 generators actually, which run by diesel in a 4th container behind me.
For the compression.
Exactly. But once I have full air, I don't need electricity anymore. I don't need power. If I open the sides of the container, the light goes in, and I can use the sign language with my assistants and with my patient. Now, going through the chamber from right to left. Environment control system or air conditioning and dehumidifier to remove humidity and extra heat. A smaller recompression facility built into the body as a window to pass tools and to pass fluids or anything needed by the doctors. You are Elena?
Sam.
Sam? Sam, if you're strong enough, you can push this black handle backwards. But you need to. Your arms work?
You can check it.
Yeah.
You already have a bandage. You already have a bandage.
That's not budget.
This guys allows me a hatch.
Yeah. To compressor, recompressor.
Bravo. Exactly. Good point.
Like submarine.
There is
It's like a blow.
an insulation valve. with pressure and deep pressure valves to allow me to pass things. However, everything that I pass must be pressure compliant. So I cannot put something which has too much air inside.
Yeah, like a bag of chips, for instance.
Oh, a bottle of water closet.
If I have an ampoule, bro. If I have an ampoule,
inside, I found a bottle of water from the doctor open.
That's
or loosely closed.
Or cups, yeah.
It can spill, so we use the bottle, but loosely closed, so half closed. But if you have an ampoule of medicine, you have to empty it in the syringe, keep some air in the syringe, and pass it through. Otherwise, the air pressure can break the ampoule. Well, let's continue. You see the arrows going in, which means airflow. But there are 2 arrows, and there are 2 compressors, and there are 6 tanks. Why? Because there is always an element of redundancy. If something breaks down or needs maintenance, I shift to the working and operating one. Sorry, guys.
So the main one is the main one, and this is the redundant.
Primary and secondary. Yes. For the exhaust, you see the arrows going out, but there is only one exhaust, and the smaller exhaust attached to it or another limb. That's for fast exhaust coming up and for slower exhaust. If I set this one to the flow meter, I determine the exact rate of ascent, which I will talk to you about in a second. I have a carbon dioxide analyzer with an alarm.
Nice.
I have an oxygen analyzer with an alarm. I have a light control system, and I have a communication system. For the light control system, I have 3 bulbs, halogen bulbs situated outside so that there is no heat going in, and all the electric cables are from outside, so there is no electricity in. The light reflects through the fiber optics, and inside you get cold air. I have a dimmer to control the intensity of the light. I have a fan to cool down the halogen pump so that it doesn't overheat. And the bulbs that you see are changeable. Like you can open the case and change the bulbs from outside during operation without any problem. It doesn't affect the performance. The oxygen analyzer is as simple as it's a sensor running all the time, and it gives me a reading if it's higher than the toxic levels. And for the communication, I have the inner lock for the inner chamber and an outer lock for the outer chamber. Now, what does this mean? The chamber itself, the capsule itself, has an outer shell, but from inside there is a partition here. This partition separates a lock from the main lock where I carry on the main treatment. So I put the patient and carry on the treatment in the main lock, and I keep this one always open. Why? In case I get another patient, so I can compress him to the same depth and allow him in. Or if the doctor or nurses need to be changed, I can also do the same. There is a mechanism for it, very easy, but I will talk about it later. Now, I get a telephone call, and the boat tells me we have a diver, 50 years old, experienced, in a good shape. He's been doing 1 week of diving, and he came out of the water with blue patches on his skin, and he does not feel one hand, and he feels extremely dizzy. This is suggestive of decompression if you have any information. So I get the medical history, if he filled up a medical, if he takes any medicine, if there is any medical history I should know of, and put him on oxygen right away until we know what's going on. So oxygen is very good first aid regardless of the cause. As long as this person has been diving, oxygen is a very good first aid. Then we get the
Can I
details.
ask you something? Because we just finished, this is the end of the safety workshop. And in terms of providing oxygen to the victim, in terms of time, how much time? If he's conscious, like 5 minutes and then a rest, and then 5 minutes and then a rest a little bit, like we was doing inside here, or it's better to keep it, and then if we start to feel a little bit tingling and feel the toxicity and understand what is the toxicity in terms of physiology during a dive, during a decompression, during a deco dive with 6 meter oxygen, and how long to do it, and how, if you can tell us.
There will be many things you hear,
Of course.
but I can say that medical facilities like ours, I'm not speaking about myself, but medical facilities like ours will always recommend and suggest continuing oxygen breathing until you get to medical help. So don't stop the oxygen as long as you have enough oxygen until you reach medical help. When do you have to watch out for your oxygen reservoir? If you have another potential patient and you don't have enough oxygen, so maybe you need to split your oxygen to keep them both in a good shape. You change the rate from 15 liters to 10 liters to 6 liters according to the condition of the patient. You shift from demand to free flow according to the condition of the patient, but do not interrupt oxygen breathing as long as you have oxygen. And if you run out of oxygen, use nitrox until you reach a medical facility. The interrupted pattern of giving oxygen, then air brake, oxygen, and air brake is for recompression treatment tables. And this is designed for a different purpose than what you think. In normal condition, normobaric condition, there is no oxygen toxicity because you are not under pressure. But in the chamber, we are giving hyperbaric oxygen, which is toxic in more than one way according to how you use it. Pressure. Bravo. So, for example, this is one of the most common recompression treatment tables we use. The US Navy Treatment Table 6. The most commonly used all over the world, the most successful by all means. It is one of our preferred treatment tables and gives us very good results. Treatment of recreational and technical diving accidents. Treatment of type 1 and type 2 and type 3 decompression illness. Highly successful. So we use it a lot. There are two patterns in it. A deeper part to 60 feet or 18 meters where you give 3 interrupted oxygen of oxygen breathing. And then you go slowly with a rate of 1 foot per minute allowed by this flow meter, which I can set.
Antonio did it, right?
Yes, can be because we use it a lot. And then a shallower part at 9 meters where you give 2 oxygen air break, 2 long oxygen intervals of 1 hour each, separated by 2 air breaks. Why do I give the air breaks here more frequent? Because I worry about CNS toxicity, central nervous system toxicity. The two types of oxygen toxicity, one of them is dependent on depth, which is the central nervous system toxicity, which comes in the form of twitches, nervous stimulation, convulsions, hallucinations, tinnitus, ringing sounds. And there is one dependent on the time or the period of inspiration, and that's the pulmonary toxicity. And this comes in the form of cough, chest pain, some kind of heavy feeling, like stone feeling.
But that's
This
because of the oxidation power of oxygen, no?
True, because of the production of what we call superoxides.
Yeah, superoxide.
If we are exposed to oxygen in a very high concentration at a certain duration or certain depth,
A lot of
we
free radicals.
metabolize it. Bravo. We metabolize it in a different way, causing the production of excess free radicals or superoxides. We are not designed for. That's why you take antioxidants to reduce the production of superoxides. Remember this one, guys. This is one of the most influential treatment tables all over the world, and until now, there is nothing that did better. Once you know how to use it and functionalize it. There are, of course, other treatment tables. For example, most commonly used one in Egypt in our facility is CX30. CX stands for comics, 30 stands for 30% oxygen, and the difference is in helium. It goes down to 100 feet. It's the other way around. You go down to 100 feet. In this period, you cannot breathe 100% oxygen. It's equivalent to 30 meters. You get convulsions right away. So we can use nitrox mixed in our station here between air and oxygen. Or I have already always 2 tanks of heliox 50-50 all the time. If I get a bad technical case with certain presentation, I know I will use this treatment table. I will roll the tanks to refresh the mix and then connect it to the chamber from an outside source and use it inside right away. Sure.
Because in this DCI there is 3 types, right?
Yes.
Say. This one is for which type? Or it depends
This
on
is
the
for-
symptoms.
It can be Elena, right?
Yeah.
It can be Elena that the case presents with more than one type. Actually, type 1, type 2 is more for divers and for students, but in medicine practice, it doesn't make a difference. We can diagnose a neurological DCI or others. Like let's say somebody with skin decompression.
Yeah.
For us, this is not bad and not severe, but if it is skin decompression with central nervous system manifestations,
So then
we think of it neurological, and this is much worse.
Thank you.
Technical cases, mostly all, come with neurological presentation and usually males and usually paraplegic. So the lower half loses function. So no motor power in the legs, no sensation in the legs, no control of urine or car. So we have serious interruption of the functions from the nervous system on the thoracic level.
So then this table 6 is just not possible to use, right?
Not
Yeah,
very
it's
satisfactory.
dangerous, no?
This was the diagnosis in the beginning for
But
the second technical
this is
tablet
not easy.
after
This is 7.5 hours
Yeah.
and very costly and very heavy on the system
Yeah, because
and
of
on the
helix,
patient.
no?
So
As well.
So the helix, you just plug it to the chamber and it get infused in the atmosphere of the chamber,
no,
or it's administered with a mask.
we have a delivery system for the oxygen or for the breathing gas called BIPS, built-in breathing system. And this built-in breathing system can have different varieties according to what I feed it. According to the treatment table, which is based on your diagnosis, you will choose the treating gas and pump it accordingly. Just behind you guys, over there, that's a connection to the outside. I put any tank of any gas that I want through, goes through the 10 micron filter to ensure purification, through the Haskell pump, and then I pump it through the system. And it goes in the regulating mechanism, 560 to 70 to 10, which is the amount needed for the breathing gas. There is another treatment protocol. Maybe I'll show you just out of interest. I'm sorry for all the scribbling, but we are a busy center. So
But
we are
can I ask you, can I have the scale from personal one?
Yes, you can. Sure.
Thank you.
Just- that's a smaller recompression treatment table, but it's not designed only for divers. It's designed also for other indications of hyperbaric oxygen, like, for example, people with problem wounds or other medical conditions, not diving related. But we found out that if we use it as a follow-up after an initial treatment of this or table 6, it provides us very good effect and shorter duration and less costly. So for financial reasons, for tolerance reasons, it is more affordable and more tolerant to the people. Here we go to 4 intervals of oxygen separated by small 5-minute air breaks, total duration 2 hours, at the depth that I desire according to the diagnosis. So it can be 10 meters, 12 meters, 14 meters, 15, up to 18. When I increase the depth, I increase the effect, the influence of the treatment.
Can I kindly ask, how much costs this treatment?
I will tell you something better.
Yeah.
1 hour is 750 to 850 euro.
This
Any table.
Inside the chamber.
Any
1
hour.
hour.
If I use heliox,
Yeah.
then increase 50 euro
Yeah, for sure.
for the
Sure.
time.
Yes.
For the time.
Do you want? I will give you an example, like because I went through one issue in Cyprus, and I did this 2 times later on, just to make sure that everything's fine in Cyprus, because it was like a big chamber where you can
A
up to
chamber complex. Yes.
yeah, I think it's 13 or something people. I can't remember now the number, and they charge like they have this treatment for like COVID and
Other
all this kind of
indications, yes.
stuff. So maybe because it was special they did for me, but the price was 150 euros.
Very true. If you
Yeah.
are using it for non-diving related,
Yeah.
you take the smaller sessions, but
Yeah.
you put more than one patient. So the
Yeah,
session,
it was like 4 or 5
the
inside.
session becomes divided on the
right.
patients.
Yeah, and then it's
When I show
cost-
you the other chamber, you will understand.
It's like when you rent a boat, you know.
By
yeah,
the way,
yeah.
this will not be easy to do, Elena, if you have a diving accident, because the
Yeah, for
diving
sure, for
accident,
sure.
it can be.
You cannot wait to
Yeah.
people
Yeah.
to join you.
Not only
I'm
this.
just saying, because we started to say
Yeah.
something not related
sure,
to diving.
sure,
That's
sure.
the price how they charge in
But I will tell you
Cyprus.
also another reason.
But emergency, of course, it's
In
expensive.
practical life, what can happen?
Yeah.
If we get a case and we don't have enough information
Yeah.
because the patient doesn't want to talk,
Yes.
So this happens.
Yes.
it can be that I am here and I start to ascend and then the patient will deteriorate. This puts us in a very bad situation because we cannot come to the surface without killing him.
Yes.
This means we have to shift to a saturation treatment table, which our colleague here, our smart colleague, is photographing. Look behind you. This is a flow chart. If you do not fulfill recovery enough to make the decision of ascent surfacing, you have to shift to the next treatment table. You can go up to table 4, and we're talking about 40 hours inside the chamber, so almost 2 days. You have to maintain life support, you have to maintain fluids, you have to change doctors every 5 hours. Very heavy work, very heavy duty.
A lot of Sudoku.
That's why I cannot risk and put two patients that might not be
Yeah, yeah. In
compatible with
Cyprus, they even have Netflix.
That makes sense.
Cyprus.
but also it can be that they are working mainly on more stable cases, like for example diabetic feet.
Yeah, they work both, like diving related.
Our
and
patients are not in the mood at all for Netflix, or they are like hardly conscious. So, any questions here, guys?
Amazing, nice.
Did you say 18 meters is the largest depth that you simulated?
No,
Yeah.
we can go even to 30 meters, 100 feet. And there are other treatment tables that go to 165 feet or 50 meters. But these treatment tables now are getting a little bit obsolete. Why? Because to go to that depth, you resaturate the tissues with air again, even to a small extent, as if you're shaking with a Coca-Cola bottle. So on the ascent limb, it can be that you suffer some consequences. This treatment table used to be called table 6A, and it was successful in arterial gas embolism. So it was helpful also in skin divers on a champion level. So Nono Gomez, the big names in the old days, they used to do some and Herbert Nietzsche and all these people would do suicidal records. And at the time, there was not enough information how to deal with them. And on the MRIs and the CT scan, there was undefinite signs of ischemia or strokes. What is undefinite? Usually in medicine practice, if there is a stroke, we get certain criteria and certain signs that allows us to make a clear positive diagnosis. In diving, it is vague. So we don't know, is it something organic in his body or is it something diving related? However, we cannot wait if it's diving related because it will be permanent damage.
Yeah.
So we would recompress. What is the choice? You ask the American school, they have an answer. European school, they have an answer. Chinese, they have an answer. Southeast Pacific answer. And we have our own experience. Open to all suggestions, of course, and we communicate with the biggest professors in the world and mainly with the Dan research facility. So we don't make an arrogant decision about it, but we give it our experience also. And we found that table 6A can cause more damage to the patient. So we stopped using it and we used more the comics. This is French from Comics Marseille. And this is a company that deals in oil and gas sector. And they invented their own
divers.
Bravo. And they designed their own recompression treatment tables. They were not open for use until lately because we pushed so much. It was helpful to the divers. So if somebody comes with, excuse me, I will just finish my word. If somebody suffers a serious neurological deficit in the cerebellum, which is the commonest in skin divers, the cerebellum is the center responsible for balance and other functions. We would not hesitate to use it, but bloody expensive, bloody exhausting, 7.5 hours, the patient is finished. But next day he can walk. And this is what we hope. God forbid there are still some symptoms. It is for me to decide. I give him a table 6 and this will exhaust him more, or I give him in 1 day 2 of these, which are less exhausting and almost the same dose of this. So for me to choose according to the age, the condition, the type of dive, every case has its own story and details. All this completes the puzzle for me to make a decision.
That's why accident, death, lifetime, discipline, what is paralysis, left side.
Exactly. It helps us to make a
Lifetime,
decision.
DCS, decompression sickness, surface time.
How deep do you do the tests for the maintenance?
How
How deep do you pressures or
the pressure rating of the chamber?
do the testing for maintenance? Because without people inside, do you test it?
This has to be regular.
Yeah.
Every 4 years, there is something similar to a TÜV,
No,
to a
sorry.
German standard.
Do you pressurize the chamber for tests just to see if everything is working with no treatment going on?
I don't need to.
Because it's working so much.
Bravo, because it's working every day. And but I tell you, it is a fair question. Look, my friend, if I have a patient and I want to compress him to 18 meters, I put the pressure up to 18 meter and I close
The circle, the
the
system.
system. And we wait. If there is pressure lost regularly, then there is something leaking. But I can tell you comfortably, we lose only 2 feet. No, you will know why. Here, it's very hot. And the air, when we compress it, is hot. So when we start the air conditioning, the environment control, it cools the air. What happens? The specific dynamic energy of the molecules get less. It shrinks a little bit. We lose the 2 feet. We compensate them. If you shut off the air condition, you stay. If you start, you lose the same 2 feet again. It's very weird because the volume, the
Gets
volume.
very hot.
Oh, here I have to tell you something. When there are ladies inside, it can be that the heat goes back again to. I think it's to do with the heat production, like the body metabolism, but it's very common with ladies.
Okay.
With the 2 feet, we notice.
Can I kindly ask about the dive insurance? Do you work? I see Dan stickers.
Dan is the most active insurance company in the area.
Yeah, but because I had some not really pleasant experience was done in Cyprus. Okay, when it was emergency case, I was certified as a dive instructor. Whatever it takes me to get to the chamber, but then they were refused me to go again to this chamber because probably it was too expensive for them. So they have like similar, I believe, I didn't see it in other city chambers.
They can recommend places.
Yes,
But
that's what they did.
We don't work as a team with them.
Yeah, of course. And I understand how they were thinking, like to reduce the cost, of course.
But I will tell you something.
Yeah.
When it comes to, of course, the recompression chamber or center must generate profit to be able to survive.
Yeah, for sure.
In our area, some people might think we are expensive.
Mm-hmm.
And this is true. If you compare it, for example, to Western Europe, it can be that the hour will cost 100
because
euros.
gas probably more expensive than in Cyprus, let's say, right?
In Israel, 1,100 for the hour.
For sure.
In other places can be more, and other places can be less. It depends on many factors.
Yeah.
For example, and there's some details maybe you will not be able. We bring our oxygen from Cairo through the tunnel.
Mm-hmm.
To go through the tunnel now, security measures puts an extra cost. That is, by the way, this place is not a private place. This belongs to the Ministry of Tourism, so it's government owned.
Government. Okay.
Yes, but run by a company which is specialized in tourism to be able to handle the tourists and stuff like this. Because the Egyptian bureaucracy is suffocating. Like this would not work if it would be government run, but it's government owned. So all the prices and all the overcost and all the details are over.
So my question would be, for example, in case someone has accident, which dive insurance will cover to be here?
I will tell you honestly, and this is not advertising.
Yeah.
The best diving insurance I've seen in the last 25 years. I've been working in the business winter. Then Europe, not then USA.
Maybe because in Cyprus it's not really working because they stopped to work with this really amazing chamber, but it's private chamber.
It can be that you had a bad experience.
Yeah.
And I'm speaking in general, like I can comfortably say I have participated
I had the same how to say understanding with them until I get my own case, and I was like a little bit.
We treated in this center around 1,500 cases.
So
maybe 1,000 of them then.
Yeah.
The biggest amount of diver professional will.
What about Dive Assure? Do you work with Dive Assure?
Less. They are less.
Dive Assure is.
We work with all companies. Europe Assistance, Mondial Assistance, Dive Assure.
There is a specific like Ukrainian and Russian companies. Same.
Russian companies and Ukrainian are very funny.
Yeah, I know. That's what I heard in Cyprus as well.
They give you a policy, but nobody answers
the phone. For me to know in case I will travel, because I'm coming sometimes. I'm a scuba diving instructor as well, sometimes with my students, so I know that.
Trust me.
Then,
if you are a professional, then Europe is the best for you. End of the story.
Maybe not in Cyprus, because they stopped to work with this awesome chamber, you know.
I tell you, there was a problem somehow, somewhere, but.
I hope that they change.
I'm telling you from a point of
experience.
What
about Dive Med? death insurance?
Aquamed.
Aquamed. Yeah.
Aquamed is also very good, but I have seen nothing like. There are details.
Yeah. So you recommend
Look,
them really?
let's say I get a very bad accident that I cannot treat here.
Yeah.
Catastrophic case.
Mm-hmm.
If I ask them to repatriate the case, they will send a Lear jet to carry the patient in 24 hours. You
Really?
understand the cost?
This is Dan.
This is Dan.
You know, I don't know. I had another accident, like a mild skin bend when I was working in Jordan. And then it was like so long communication with them to allow me to go to the chamber because they have also similar chamber what we have in Cyprus, this private one. And then in the end, I didn't went to chamber. So I was just breathing oxygen. So I believe my second case, which happened, like it was simple dive.
You have a lot of situations with them?
No, only this two stage. Maybe I don't know how to properly communicate.
I think
with
it was
them.
problem of communication, honestly.
Yeah.
I tell you, we have a lot of Italians, Tito, know
Yeah.
that go beyond physical mind can go.
Mm-hmm.
Italians here make
Dan,
experiment
you
in
know the
diving.
name. She said, okay, we know
Ukrainian,
the
Russian, the same.
No, the Ukrainian, I'm sorry to say,
Yeah.
they die before they come.
Yes.
We don't get a lot of Ukrainian or Russians, they die before they
I
come.
know.
But the Italians come.
Okay.
And then there is a real challenge because medically, there is nothing that we can understand to do about what they did.
Mm-hmm.
It's beyond our ability sometimes because we need a bigger facility with bigger intervention. Like I need an MRI beside the chamber.
Yeah.
This I don't have here.
Yes.
So if I contact Dan and I say I have a case, an Italian, and he says he's then insured, and he is this and that, and I cannot manage, they will communicate repatriation within 24 hours.
Yeah.
This happened at least 3-4 times. You know the cost of a Lear jet coming from Riga, Swiss, to Sharm Sheikh, land, ground services, take a patient and fly out, one bar cabin.
Yeah.
We're talking about minimum 30,000-40,000 euros transfer only.
Yeah. But you know, like, I'm sorry, just about the dam, just to finish. When I had this skin bend in Jordan, I called them and then sent me to the chamber, which not operated for a few years already in Aqaba. It was accident. And then I said, guys, I'm going now to this private hospital where like now they treat there. So I was really surprised to hear this kind of information because I believe in Aqaba is happening quite often.
The diving is very shallow in Aqaba. There is not a lot of cases, Elena.
Look, it was one wreck which is located at depths of El Sharuk, I think. Yeah.
This is the only interesting dive sites as far as I know.
Yes. So I don't know. Maybe I don't have. Or when I had my accident in Cyprus, I communicated with the doctor by phone, Russian-speaking doctor. First, I called them and they said, is it okay if you will wait for 30 minutes? And I said, if you think that I will be fine to... And I was breathing oxygen. Thanks God I had my oxygen. So he called me in 30 minutes. The doctor, after accident, I called him that I don't feel my left side. He said, maybe you hyperventilate.
Okay.
So with all this information, I was like, really?
I think I can conclude a couple of information. One, there is a problem with communication.
Yeah.
Two, you're a troublemaker.
I have a question.
She's Russian.
Elena, can I?
Oh, Ukrainian.
Thank you.
I'm sorry, Elena.
It's like 12 minutes. I want to ask a question.
I'm not saying it in a bad way.
Do you get a lot of saturation divers in this area?
No. Man, thank you for the good questions, man. There is no saturation activity going on, but there is up north in the Gulf of Suez, where there is the oil and gas sector.
Yeah.
There are commercial divers that do some sort of short and less dangerous saturation divers. These we get catastrophic cases.
They send them here
because there are no chambers up there, and they know more about us than they know about the other chambers in Cairo. So they prefer to call us and transfer the case south towards us, 3-4 hours, that they get the treatment. We managed to stabilize the case, but these cases require very long therapies, about 3 months or 4 months with physiotherapy in hand. So it is different type of management.
Diet.
In Egypt, you will not consider this a lot, but at least the basic things like recompression chamber and physiotherapy, this is the main treatment for them. And this you have to provide for at least 3 months minimum to
Mm.
get them back on their feet.
Mm.
Usually they are young boys, so most of them can have a good chance of recovery. As we get older with the age, the prognosis is not as good.
How are those patients transported?
Usually with ambulances. South China is an area C, so for security reasons, they don't allow search and rescue flying. But with boats, you can do this. With ambulances, you can do this. So mainly
There's
car,
no
the fastest-
elevation risk on land here.
No, does not
If
exist.
there is an accident, let's say scuba safari boat trip on south of Red Sea, they will bring the patient
There are other chambers on the other side, Elena.
by boat as well.
Usually by boat. The boat has to
Mhm.
come back because
Yeah,
the
yeah,
search
yeah.
and rescue does not operate deep south.
Mhm.
But there are 5 operating chambers on the Hurghada coastline down to Marsa Alam. And if you are diving there or making activity, I highly recommend that you check their sites on the map so that you know orientation and you get some telephone numbers and try the numbers because the numbers there are mobile numbers and they do change often. So you need to make a telephone call. Hello, I'm Elena.
Yeah.
I wanted to know if
I'm
the
a
chamber is...
troublemaker. Can I-
Yes, yes. then
drops on
then
the-
troublemaker.
I'd love to book your chamber.
But you have to ask. First of all, you open a communication line. Second, you make sure that the place is open because
Can
it
you tell
can-
us also why in the hub is closed? And
No,
it's closed.
it is closed, but
What's going
we
on?
had a chamber there
In the hub.
in the
Yes.
house, and we were doing very well because there is a lot of technical activity going there, and life was good. We were able to continue providing our service, and the chamber was covering its cost. But after the Russian aeroplane in 2015, the tourism went low. Most of the nationalities that dive in Dahab, especially in the Blue Hole, are Eastern European nationalities. They started to get less. When they got less insured, less divers,
No
That's
financial
money.
reason.
and
right?
then also the companies, the government was asking for more price, increase the price of electricity.
Yeah.
Over there, the system is LP, low pressure, not like this one. So it tends to cost more in electricity consumption. This caused the running cost to be higher than the revenue. We had to shut down.
So basically, you don't recommend to do technical diving anymore in the hub, right?
Look, Elena,
Because there is also
You have
the
to
high
use-
point.
Because of
The
what
high
this,
point.
No,
yeah,
the altitude is
that's
very- No, you can do, but you have to be wise. You have to use common sense. So, for example, you make a good plan that you are able to do it. You have to know your limit.
but still there is a risk of decompression sickness.
Always,
even
in
if
every
you
dive.
In free
every
diving
dive.
too. So
Yeah.
that's why, guys,
Yeah.
don't fucking push.
صح.
The people that don't know what is Tarawan, now they want to build a platform in the hub. I say, what are you doing a platform in the hub?
For
Say,
example,
we have
these
the
ideas,
helicopter, see, bravo.
and you go there and you find all the great
I know.
stones everywhere.
I
Like,
know.
you have to know your limit. You have to train your limit. You have to supervise your dive. You have to get somebody to supervise. And you always have to accept not criticism in a negative way, refining your performance because not because you did 100 meters, you are a 100-meter diver. No.
Repeat a
There
million
are-
of time.
There are people who have the physique to tolerate this pressure, and there are people who cannot. We have to respect this because then we get the accidents we hear and we see the differences, but only when the shit has hit the fan.
Yeah.
Two questions.
Sure,
if I
please.
may. You said it, but I forgot. Since when it's working? This camera?
1993,
1993.
March 1993, non-stop, every day,
Non-stop,
because there is diving every day.
Wow.
There are seasons where diving gets less,
Yeah.
Impressive.
and seasons of higher. And
There's another one.
there are 3 chambers in Sharm el-Sheikh.
But they use
Two
for
here.
hospital treatments, not so much for diving.
No, it's a diving destination. It's mainly for diving.
Okay.
But 2 of them are here,
Yeah.
and one of them is in the Pyramid Hospital, which is governmental owned and run. So the bureaucracy killed it, and nobody's using it.
And it's what kind of chambers are there?
That they have there, it's a Dutch. I
Okay.
think it's called StarTech, the company that produces it.
Starman? Oh, that's
StarTech.
House.
No,
that's
House.
German. It's German.
House is German. StarMed is the model of House.
Okay.
Is a model because they
Yeah,
have
yeah.
many models.
I know. And another question is, how long have you been diving?
1997.
Do you have any data points on what this predisposes someone to DCS? Physiological pre-existing conditions? that
Yeah,
can-
yes, true. The commonest hypothesis and theory is dehydration, and dehydration can be due to many reasons: decreased intake or increased loss. the hot weather, perspiration, diarrhea if you have bad tummy, which is common with tourists here. Seasickness prevents you from eating or drinking enough. Alcohol dehydrates you.
Yeah, sure.
All these factors put together puts you at a certain risk. Changing the environment and then the degree of temperature of the air and humidity. Then the exposure to the diving condition itself. The moment you breathe the compressed dry air of the scuba tank, you start to humidify it with your own body fluids through the respiratory tract. This puts you a little bit on the hydration level down.
Sure.
And we get to measure the hematocrit, or the percentage of water in the blood. In a diving accident, it is almost a common factor that they all have low hematocrit. Like the percentage of water in the plasma is too less. That's why it's essential to rehydrate patients either IV or orally, as if they are able to swallow, of course, as early as possible.
But in terms of pre-existing conditions or genetic conditions,
Yes,
have you seen any commonalities?
No, we cannot say congenital, but we can say pre-existing in the way that obese, overweight, high body mass index tend to be more prone to skin decompression.
The nitrogen gets stuck on the
In the
fat.
fat, yeah.
And the opposite for the narcosis in freediving. This is what I noticed. Skinny we are.
Yeah.
The nitrogen is going more in the system instead to get stuck in the fat. The narcosis. That's why the
So you get less DCS and more narcosis.
It changed a little bit. But that's just recently, because I used to think also like you, Tito.
But depends, is individual. The variables, they are for all of us. I have athletes that get narc at 40, 70, me at 120. So different toxicity and nitrogen.
That's why I'm telling you, there is no common factors here.
Yes, it's a variable, they
individual
are for each of us.
And are any long-term studies conducting here? Are you doing any long-term?
We are not a research facility, unfortunately. We are two-man show here.
2 men. Okay.
2 doctors running the show.
Any nurses?
No, no volunteers even.
How many people operate? Just one?
You need
outside
one to operate
and one inside?
Like it can be that one, if bad cases.
Yeah.
There will be one doctor outside and me inside.
Yeah.
And then
Why no volunteers? It's very interesting.
Not a lot of people like the condition. You need a certain type of doctors to be able to leave Cairo or the high competitive areas to come to a relaxed remote area like Sharm Sheikh, live, settle down, and then work in this kind. And also our life is also not fun in the way that you get telephone calls and emergencies anytime. It can be that somebody symptomatizes on the boat or on the way back or late in the night when they have a hot shower, and then they start to have symptoms. Also, there are mainly professionals, they have denial. So they would have symptoms earlier and they would hesitate. And then 9 o'clock, I get a call from Dahab. I can't leave my bed. I can't move my legs. I can't pee. I can't. Then you have to think about transfer over the altitude, like Tito said, safely, and how you will manage the case. And we have to be prepared from the information and the history analysis we took from him, what we will decide to do.
In this case, in case of the elevation, 900 meters is in the...
You have to go through with oxygen.
Yes, okay, it's the only best way to provide oxygen. No, flebo to hydrate, but for sure is...
Oxygen is to minimize and reduce the deterioration as you reduce the pressure on the patient system.
But like if you have a very bad case, let's say in the hub, you would still go for oxygen and car through elevation, or would you try to arrange a boat?
It's even better.
No, the car will be the fastest. The boat and the police stopping them on a night trip. No, it will take so long time.
1 hour and a half, they told me.
There is always, if you really squeeze your mind, there is always one more step that you can do. Like for example, I would say, let's say there is a chamber there, but it's not working because there is no staff. There is a very bad case and it will be very risky to transfer. One of us, me or Adel, will travel to Dahab, open the chamber there, which doesn't belong to us, but belongs to other people, but we will convince them if it's operational, and we will recompress there and save the patient the risk. This is what will happen. But this is not always easy.
But like in 1 year, how many times that happened?
We get around 12 cases from Dahab every year.
No, but did you do this? Did you go there? You open
once
the
every 2 or 3 years.
Okay. So really bad
because
cases.
it has to be catastrophic.
Yeah. And you don't know if the chamber is operative there?
Okay, I'll tell you what. On our compressor system, it's called secure system. It's
I know.
very good. So if the filters are
Secure.
super saturated, it doesn't work until I change this filter. Yeah. But this is a secure system. If they have a different system there or similar system and it's blocked, he could not fill air. If he doesn't have air,
So there's no maintenance.
there is maintenance, but it can be that he run also out of spare parts. Now, because of the tunnel situation and the security, we stock. So let's say, for example, I get my filters, I order 40 filters. I don't order 2 by 2.
Yeah, sure. Big
Why?
stuff.
Because I need to be, and with my consumption, they work only 40 hours. So I know 40 hours, 40
Also because
filters,
of the quality.
it will last me maybe 3 to 4 months by the time the next order comes.
Can you tell us about lung squeeze and provide the oxygen better and not better? If there is a lung squeeze, if it's light, it's better to provide oxygen a 6 meter, 5 meter, how long, and switching, like what I'm doing if there is some kind of lung squeeze, like I provide.
This is provided that you are sure it's a lung squeeze.
Of course, yeah, because if it's trachea, it doesn't work. The oxygen.
And what if it's a post-COVID syndrome that is getting confused? Because now our medicine practice with divers before COVID was something, and after COVID it's something else.
Yeah.
We have to see in a different way, Tito. So, for example, COVID, one of the problem of COVID that it makes changes in the bases of the in the lungs, called atelectasis, where there is collapse and it loses its elasticity. This causes sometimes undefined suspicious symptoms that you cannot really relate. It looks like an embolism due to an overexpansion, but the patient did not hold his breath, skin diver. So how come? The only explanation is he suffered COVID in 2019 or 2020. The follow-up CTs were normal, true, but on a very microscopic level, there was some residual damage.
Sure. No, I'm talking about if I know it's a lung squeeze.
Let's say that you are sure, and the case is mild, you start the oxygen breathing as early as possible, which will be under the water.
Yes, 100%.
And this will relieve the patient markedly until the surface, and there you take him on oxygen until you see the doctor or do what is necessary. But let's say the patient could not even tolerate staying under the water, which happened in the
normal baric. Yes.
Then you go out and give oxygen. Oxygen will never harm a lung squeeze. It might not relieve him properly,
yes,
but
it's to help the hand.
But at least you make sure you have
but at least you give the proper first aid until somebody confirms diagnosis and take it from there. There is a big variety spectrum of cases.
Of lung squeeze, I would love to show you some pictures.
That's why in medical statement now, scuba divers after COVID, they change and they made like mandatory when they're asking health issue related COVID. If you have a COVID.
And there was a rule, 3 months, no diving after COVID. And from our practice here, some people took more than 3 months for the CT to be normal. So they had to make more than one CT. And you know what? This is not even enough because I had people who are technical divers. Technical divers dive solo and they cannot tolerate mistakes. Like mistakes kill them. So if I would see any details on their body, not only on their lungs, that shows delayed recovery, not full recovery, I had to postpone. Some people went from the age of 52 to the age of 56 recovering. At 56, I had to run a complete different test for eligibility for technical diving. See the complications and what it brings.
And also this oval, I forgot in English.
PFO, the oval window of the heart. Yes.
It's also, but some not. For example, I checked. I know that I don't have, but some patient doesn't know.
But let me tell you something, Elena, because of what you said now. PFO is present in some around 28% of the people, so 1/3 of the population. So 1 every 4 average randomly. But it can be that you make a test and it is negative, but actually it's not true. Why? Because at a certain phase in your life, if you gain weight or if you lose weight or your heart gets sclerosed, like loses its musculature, a hidden PFO that did not show on an echo, it will start to leak. We got so many divers with like maybe 10,000 hours of diving, technical and rec, and never had a problem, started to symptomatize at a later age. What are the changes that happened that made it occur? body mass index. They changed because they got married, their lifestyle changed, they are not as athletic anymore. And aging. Aging scleroses everything in our body. So your lens of the eye is not the same. The drum of your ear is not the same. The membranes and the filters of your kidneys are not the same. These are factors that are not calculated. Now, with the diving industry, and because people are working in it, they push the limit and the time of work for as long as they can. They are dependent on the salary to pay the rent. But the body is not designed for this.
It's like
But you can-
O-rings getting rigid.
Bravo.
But the body he can get used to the oxygen. I mean, somehow get addicted and the tolerance and somehow. What do you think?
Yes, it can be, but this is a dangerous area.
I know.
also.
I know.
I know what's coming behind. Like,
I know.
you hold your horses now, huh?
Yeah, I know. But
Imagine-
we was part
But I will tell you something. And I will tell you this. Basic medicine, not diving medicine.
Sure.
In life, the oxidizing factor is oxygen. Oxidation in elements, in wood, in metal, is aging for us. Is aging for us. So when a metal oxidizes, it's aging. It's getting older. It's oxidizing because of the oxygen, and we are aging because of the oxygen. So if I run your oxygen hour in the chamber faster and longer and deeper, I am throwing you into the aging process.
Sure.
If you do this in other activities, it will affect you to a less extent, but it will give you high performance for a short time.
Sure.
And then on the long term, you are aging. So you have to be very careful what you're doing in the wise way, because we really need our health at the end, not in the beginning. You know what I mean, huh? I don't like your job, guys.
These are very wise
You
words.
don't like our job?
I don't like your jobs, huh? Including his. And I give you this advice as a friend, not only as a doctor, but I know it's a passion for you. So you do what you like. Absolutely, you're doing it very good. Sure, we need crazy people like you, but
to study.
at the end of the day, you have a family, you have your career, you have your main investment is health. So
That's why we are here, to understand
True.
what to
And-
avoid
and-
and understand how to die.
and I'm giving you honestly, really what I believe. That this is my honest opinion. People will not like it because it's against diving, against Paddy, against Dan. They want more people to dive. Yalla, get cards, get.
But I feel that you're not saying explicitly, because like we are free diver mostly. I mean, we have also scuba diving, but
free.
like he's not a scuba diver.
Yeah.
So,
Sure, I
so
know
you're saying in a way that free diving is not like, or is not a good investment in that sense of like aging and stuff, or you're just saying beware of like how much oxygen you're.
This is one of the aspects. One of the aspects. Of course, when you know what you're doing and you're doing it fine and you're doing it with common sense, you get the best out of it and the least side effects. This is the good school that Tito belongs to. This I know from years. But in general, we are not designed. We are designed only to be on normobaric condition, breathing 21.
Okay.
This is
That's it.
Okay.
Something like anything in excess, even good things become bad.
We need people to push the limit so that we know how far we can go.
But those are a little percentage of
We need
population.
this little percentage because they take the rest of the population, the herds up.
Yeah.
So in technical, there are people that do this job. In skin diving or free diving, there are people that do this job. We are here to start to cover them medically as much as we can. But sometimes they put us in an area unknown, uncharted area.
That's why I was asking about long-term data or research if you have, or
I wish, but we are not research facility. And when we invited others to come here, the bureaucracies prevented the equipment from going into the airports. We used to do some fantastic. We had here the craziest amount of divers ready to do everything. Ready, I'm really serious about what I say.
yeah, we're here.
And this generation is getting less and less because they were also good in what they are doing. So they were crazy enough to
do it.
To be test monkeys, but
No,
they knew how. They did impossible stuff, in my opinion. These people should have been studied physiologically, echocardiography, all.
yeah.
When Dan brought the underwater echocardiography for skin divers. I don't know if you participated in this research work at the time.
It was
was,
Andrea.
with Andrea once, but with Umberto Palizzari and all the
I know,
older
that
gangs.
time, no, with Umberto, no.
And Marco Nunez, I think, was
no,
involved.
before. This was before.
The equipment you have to have big housings. When they saw the big housings, they were like, "Oh, what's going on?"
Yeah.
Where do you go?
And then to explain to them, we're doing no, security reasons. No, they don't understand what's going on.
Yeah.
But it would have been a great opportunity. However, until we have this information, Dan is doing it in other places now. Until we know this, we have to respect the nature and respect our nature. And
Yeah, because like you mentioned before, there's the Egyptian school, there's the European school, there's the American school, and everyone has a different approach, different understanding, or they read the results in different way, and then they recommend different things. I was treated in the hyperbaric chamber for sudden deafness.
oh yes, in
And-
Europe it's used a lot.
And the first doctor, he said, he recommended old treatment, so old school, like corticosteroids.
But this is combo therapy.
Yeah,
for
because
deafness.
at the time we didn't have the chamber
Yeah.
in the hospital there. And then I contacted on my own, a doctor that knows about hyperbaric medicine, and he explained everything because it's 1 hour questioning. And he got me into treatment then, and then I went away so I was 5 days in the hospital, just IV corticosteroids. At the end, a little bit changed, not much. And then as soon as I got into the chamber, I was recommended 20 sessions.
True.
I did 10, and I was okay. He recommended an extra 5 just to make sure I did them. But the good thing out of this was that in the beginning, when we had the first interview before going in the chamber, he said, look, with your age, with this and this, there's an 80%, maybe 90%. The chances that you recover your hearing is up to 80 or 90%. You won't get to 100%. You won't get your hearing back 100%. And luckily I did.
But this is your lucky. That's
Yeah,
a smaller
lucky.
percentage.
You had acufene as well? Acufene? Like a earring tingling?
tinnitus, no, tinnitus, no.
It can be with tinnitus.
No. It was just
We go to the other chamber
Yeah,
quick because
we
I'm
follow.
running
Yes,
short
sorry.
on time. Come with,
follow you. Can I take one picture and hide?
yeah, sure, please.
I will show you something exactly that.
But Tito, I'm taking a nice video of your asshole.
But to reduce platelet aggregation, you need to take aspirin at least 10 continuous days. So when the French tell you take 1 gram of aspirin right away, it helps to numb the pain, to kill the pain, because it's a strong anti-inflammatory. But for the anti-platelet aggregation effect, you need 10 days of continuous use. Not only this, now we know that a lot of patients, because of the stress of the trauma, can get stress ulcers. If you give them aspirin, the ulcers
It's
are worse.
even more ulcers.
Because I'm running short on time, I will take you to the other chamber and then I will show you the other place.
Sam?
Interesting.
Oh, yeah, but they look next.
Scuba diving, let's say, or free diving. Oh, this is nice one. You don't recommend to use hot shower at all, right?
No, very dangerous.
Yeah.
This is
But nobody knows about this.
No, we tell people, and it is mentioned in many places, but people just ignore it. This is the commonest triggering factor for the onset of symptoms.
Yeah.
A lot of people finish 2 or 3 dives on air on a boat and then they go out and have a shower from the water shower from the shower in the on the boat, which is placed close to the engine. The water, they faint in the toilet and they need to be carried out. When they come to us, they will have skin decompression, disturbed conscious level, sometimes a degree of paralysis.
Some safari boat in Egypt has sauna on board.
That's also a bad practice, and we highly recommend against it. After scuba diving, no gym, no exercise, no hot bath, no Turkish bath, no hot showers, no.
Depends on how, if it was one dive, let's say.
There are variables,
Yeah.
but we don't want to go into gray zones. You can tell me, Ahmed, I made 3 dives, but only to 5 meters.
Yeah.
You know what I mean?
Yeah.
Or the use of nitrox and stuff like this. That's a different concept chamber, guys. This is a multi-lock, multi-place chamber that takes up to 12 patients. It has a door, not a hatch. It has the option of manual run and computer control. It has a nice facility, as you see. Life is good. German design. That's your star med. And you can choose the protocol that you want over here, and then you just run it. And you can run it manual, like a joystick, like an airplane. The details of this chamber that you should know that everything is controlled by closed circuit TV camera. It has a printer which is sealed to the control panel, which prints out the details of the treatment we do without interference. So the concentration of oxygen, the concentration of carbon dioxide, the humidity, as a medical legal report. There's a water tank for fire extinguishing. And here the fire extinguishing system is more developed than the other one, which has just a simple fire extinguisher. This one has a big water tank with 2 high pressure air tanks and a small explosive unit. Once I press that there is fire, this explosive unit will open, release all the air quickly into the water tank, driving it with high pressure into the chamber. This chamber is extra expensive because of the extra doors. Each door weighs about quarter of a ton or 250 kilos. And you see, this is the transfer lock where I can use other patients. It's okay, come in. And then you come into the main chamber, which is wider and can take sofas of seats or stretchers. The fire extinguishing system that we talked about comes in 2 ways, and this is very interesting for you to see. There are mist injectors to inject mist with the high pressure, and there is the sprinklers. So these sprinkle water and these inject mist. What's the point? If, God forbid, there is a fire, there is high production of heat and quickly. This drives the chamber to a greater depth because of the heat expansion. So not only that I need to extinguish the fire, I need to cool the body. So the sprinklers will extinguish a flame, and the mist injectors will suck the extra heat energy and cool it down so that I don't increase the depth, actually stabilize the depth. There are cameras everywhere to tell me which seat and which patient. There is an air conditioning unit above you. All the light system are big halogen bulbs, but in a casing. There is a carbon dioxide scrubber here to suck out the extra, and there are sound mufflers. This is a hatch lock behind Tito to pass the medication like we talked about. I can remove a sofa of 3 seats and add a stretcher for a lying down patient, or the opposite. The oxygen system delivery, similar to the one there, Bib's built-in breathing system. I apologize if there is any dust, but yes, we are a dusty country. And there is a vital signs monitor and a transcutaneous oxygen monitoring system. These are equipment compatible, built in the chamber with air electronic connections so that it is safe to run inside. And if I connect them to the patient, it gives me very sophisticated, important readings about the performance of vital organs and oxygen breathing saturation. Any questions here? Here, I cannot do maintenance, guys. I need to call a specialized team from Hawks, Germany, pay their tickets, their accommodation, their insurances, their everything, and make them on top rich for life to come and make the maintenance. There are 2 types of maintenance: hardware, you understand what I'm talking about. Software, I connect to the internet to the mother company in Germany, in
Heidelberger?
Karlstadt.
Karstadt.
Cars. Oh, okay.
And
Not even the the regulators, the membranes, you don't even do that?
No, I'm not allowed to do that. There is a maintenance program, a maintenance contract.
Because like the chamber they have, it's a small one, but it's the same.
Of course,
We need some-
there are different deals,
Yeah.
and it can be that they do something else for you according to the availability. But the software they will do online.
Yeah.
The hardware they have to do themselves. If we do it,
Once a year.
if we do it, there will be problem.
Yeah.
Come with me. Any questions here, guys?
How often do you use this guy?
No, I don't use it a lot, Elena, because to run it, it's very expensive. I
Yeah.
need more than 4 patients in one time,
Yeah.
and this is rare. This is an examination room. Guys, I need you here. This is good. This is my gas mixing room, and I have a mix master panel. Did you see the small nitrox filling station that I had there? This more sophisticated. I have mix 1, mix 2, mix 3, and I have air bank, helium bank, oxygen bank. This allows me an infinity of mixes. So, for example, I have my oxygen bank here, my helium here, and then I just set the mix master to the pressures and the percentages I want, and it will make me the gas mix I want. I open mix gas 1 and save it, and this will be heliox 50-50. Then mix 2, and then I will make air and oxygen, making nitrox 50-50. And then I will take helium and oxygen 70-30. How do I do this? Using the mix master and using this piece of equipment called a Haskell pump. This Haskell pump is a pump that operates with air pressure. It does not require electricity or fuel. It takes air from my air bank that I will show you now and mix it with the oxygen. The fact that it works with air pressure makes it safe to operate with oxygen in high pressure. So now I'm getting a patient, an accident. I will just go to the bank that I will use the breathing mix in, 70-30 or 50-50, and open it and run the protocol. The chamber will know that the supply is open and this is the supply I want to use. And the sensors inside will analyze the gas and write in the report the breathing gas that I used.
You check also the ventilation.
Also the ventilation.
The personal and the individual ventilation
and
of
the
the
gas
patient.
and the gas consumption, and it will calculate the PPT and the oxygen toxic doses. And usually there is a report that is printed out with the name of the patient at the end of the treatment, and this must be kept in the file for medical legal basis. Come with me.
So can we have a key to this like explain? So not like you looking will go to the small
Elena, for diving accidents,
Yeah.
if you tell me, Ahmed, if you're a patient, God forbid, which one you want to be treated in, I will tell you the small one, the old one. Faster, bravo. Time is the most important factor. 2, the delivery of the system is much faster. To fill in this Airbus size, it takes some time, and it doesn't operate simply. No, you have to cool the air around the chamber at 22 degrees. What if I lose my air conditions? And this can happen in summer. So
Maybe before the chamber it was already open because at 4 minutes the surface time.
Yeah,
Guys, please, that 100 meter at 3 minutes.
made my examination inside.
So it was ready.
For professionals and non-professionals, the smaller manual run is better. This is the air filling room with the air banks. Verticos, which is also another security system, the same concept but silent. High-end technology, very fancy, but the filters need to be changed more often and stuff like this. They are cooled with air conditioning just above them and the fans, and they pump the air into the air bank that you see behind you. That's a complete different theory. This basket came from Germany as it is, and inside it there are 2 air banks with 2 gauges, but they are all set up together so I can shift from one to another in case of emergency for redundancy. The control here to allow me to fill, and then all the gas pressure goes through the stainless steel piping that the Germans did, supervised the welding, and took the TÜV certification to send to the other side to the filling station and mixing station. Behind you, there is the mother unit for the air conditioning. So this is the cooling part of the air condition, and that's This is just that somebody moved it on. This is the most important part of the chamber, guys. This is the control panel with the cards, with the smart cards and fuses for the functions. What does this mean? Every function on the chamber has a smart card that needs to be programmed, set up to use, and every card has a main and a backup. So if the first one fails, the second one carries on. They run all the functions, and there is a USB unit to give it electricity all the time. If there is power outage, it will continue to give it for another 6 hours, half function, and then another 1 hour with one like 20% of the functions. And usually within this time, you would have surfaced with the patient and finalized your treatment.
Wow.
Now, that's a chamber for hospital uses, for hyperbaric oxygen treatments, for other indications other than diving, where you require more than one person on the control panel because there is always alarms, where you might control nurses coming in and out. People are in a more comfortable status and condition. But in real life emergency situation, you need speed, you need time. The other chamber will be more feasible. The other one tolerates a certain degrees of mistakes. Like for example, if something wet, bleeding, stuff like this, you can manage. You can manage. But here you have to be more careful with what's going on.
When I was in December, they didn't allow me to use, of course, any metal.
We will not allow metal on both chambers. We will not allow grease on both chambers. We will not use synthetics.
With this.
Anything flammable, ink on paper, we will not allow. Only cotton and no pockets. There has been accidents before, and fire hazard in chambers are non-forgiving. This is something that does not forgive. So we will not allow it in the first place in both. But what I want to say is, let's say I'm getting a case from the sea and he's in a wetsuit or a dry suit. I can put him in and take it off inside the chamber. The wet, you know? Here it's not easy. Because to decompress and compress this big volume takes time. I would love to spend more time with you, but you tell me, do you have any questions for me? More.
Can I take a picture of you again? Happy to give you a shout.
Please.
Thank you.
With both, and I will take a picture with both of them, please.
Now we're gonna take a picture of both again.
Go, I will take a picture of both of you.
I mean, this is something that I'm very interested in.
Sure. Exactly. I will be solo. They don't want to stand beside me.
Little bit, Elena. I can see.
I'm not doing the solos, Tito.
No?
Okay.
Yeah. One solo.
Wait.
Together, you have done it, please. Because it's your safety workshop.
Baby.
Even all together now. Thank you so much. Amazing.
Any questions? Anything?
No, it's
If
very.
you are in the area and you would
Exactly.
like to come again for a coffee at a later time, I'm happy to do it for you
Is it
guys and
possible to
Tito.
work as a volunteer?
We have a big group of tenders.
Yeah.
Tito is one of them that speak different languages that help us in need. So let's say, for example, we get a Russian case and we can't communicate easily. We will call one of our tenders. We run a tender course. It's a program where we train the divers how to operate the chamber, how to be inside, outside, to make a 5-minute neuro examination to give us an evaluation. And they get, how do I say it, familiarized and hands-on experience how to handle a case. And these tenders have a list with telephone numbers updated always, and we call them when we need them. So if you are in the area for a long time, you want to come and visit us, Elena, get the telephone number from Tito.
If I move to the hub,
Soon she will relocate. So
Actually, if you are in the hub, we need you more. Not to come with us, but if something goes wrong,
To understand what's going on there.
bro, I can refer to you and you can assist a little.
if
We
I
do it,
move in the hub,
by the way, we do it as community service. Most of the work done, because how they say it with the community, the diving community, people need to cooperate a little bit. Otherwise, there is
Yeah.
I'm not just
Thank you so much.
Thank you so much for your time.
You're from?
South Africa.
Oh, I noticed.
Thank you very much.
Nice to meet you. Nice to meet you. Elena, all the way. Be good.
Let's look at me, guys. Let's look at me. There we go. Thank you, guys. Thank you very much. I grabbed my jacket.
Qual è il suo cognome?
Yeah.
Qual è il suo cognome?
Non mi ricordo.
Oh, io lo chiedo. Beh, lui è Ahmed, giusto?
No, yes, I'm
The problem is when they come, it's totally like, oh, yeah. No, fortunately there we don't have like any Indians or
Actually, the experience, luckily we have in the chamber is that we are so much used now to this adrenaline that we seem to be calm. When the people from Europe come and like, oh, table six, I pump in some music from outside and they will tolerate the treatment, cooperate with me. Usually one treatment will be enough because we do it in a way properly. He knows the mask must be sealed. When to equalize, when not, fulfill the timing, tack. Next day, the follow-up is very satisfactory. Then we have the fight. I say 2 months, or they say
2 months.
too much, Dr. Ahmed. I need to work and I need to pay the rent and I need to put food on the table. So I will say 3 months. They will say 2 months. I say, okay, yalla boo.
For example, in case of lung squeeze.
It depends also on the X-ray fasting.
Yes, exactly.
So in a mild lung squeeze, different to a serious with a lot of bleeding, because I know that some of the blood will come out, some will clot inside. The blood vessels need to recover. So we're talking about 5 to 10 days for the.
For example, lung squeeze, and the people they don't even think about to use the hyperbaric chamber. Me, for independent the X-ray, I see I can suggest also amounts of from the water.
Yeah, but there are two factors here. Lung is a very vascular organ, so
Faster to recovery.
Faster to recover, faster to bleed, faster to recover. And the age, less than 30,
sure.
with some vitamin C, you will be good in 5 days. Why? But certain vitamin C is to build the wall of the capillary. Other vitamin C is for the immunity. So you know what type of vitamin C you're using. But somebody older than 30, let's say 45, and he's a smoker also or other habits, then you will put him on the longer scale, allow his body the factors that you cannot control. So it can be a month, 3 weeks to a month.
You showed the lung squeeze?
Yeah, no, but I saw many pictures of lung squeeze, like Christmas tree.
Yes.
All the belly, the vasos, capillaries all broken.
Lung squeeze is an issue for skin divers, but in diving medicine, it's not a major or a fatal condition.
Because it's not a scoop, but the blood
because there is no lung escape.
No blood.
But what do you think of like this culture in freediving where people just like after 3 days, 1 week, also her doctor say, yeah, you'll be fine in 5 days, but you see an Eric's that is like show this Christmas tree and this.
Different schools of medicine.
Okay.
And I really advise you against getting consultation over the phone. It can be an extra consultation. Take it. Every consultation is good, but if somebody can judge by a stethoscope and an X-ray or a CT scan will be the best because it will be a more conclusive evaluation.
Yeah, but even with RX, like there is doctor that say, yeah, in 5 days you'll be fine, but actually like it doesn't look that.
No, variable. There are mild cases and sturdy bodies, and there are hard cases.
So it's very subjective.
Yes.
Okay.
Okay, guys. Now it's time to go.
No, you killed me, guys.
Sorry.
No problem. Thank you
No
so
problem.
much.
You're welcome.
Thank
With pleasure. Tito, anytime, my friend. Thank you so much. Take care. Check out. I'll see you guys. You, Sam. Bye-bye.
Hope I will never see you again in a good way.
In a bad way, no. In a good way.
Next time you're in the house.
But it will increase your the depth of your information. What I want to say is like if you're out on the sea or in a remote area and the situation happens, this is the real benefit of the course. In your mind, you know what to expect and what is the best thing to do in a remote area. And that's the challenge. If you are in the middle of the capital or in Europe where there is search and rescue and fancy stuff, then life is easy. But in a remote area like Deep South,
so we contact this magic man to organize this.
Sharm is an asset, keep in trouble.
No,
And,
never.
and you will have a great time, I think, and you will learn a lot. It belongs to a very good school of skin diving. This is definitely one of the best.
The best.
areas.
Not one.
Thank you.
Yeah, for the moment, it's the best, but it's hard to stay. You have to give it your best. People will talk. There is competition. There are people with ambition. So
That's why I don't compete.
I'm talking about the educational side.
Yes, yes.
In the old days, we had Umberto Palizzari. We had really decent guys, but their times come and go, and it's hard to maintain.
Yeah, I love this.
Because also it's personal passion. If you're doing things with passion like Tito does, you give it your best, you really get good outcome. But how long can you maintain the passion?
All life?
I don't know. It depends.
No, I
Depends.
Individual. Like
Balance.
Very
If you
yes.
find balance between diving and life.
Okay?
Thank you.
Guys,
Wow.
you have a lovely day. So
Amazing.
good